BPH, or benign prostatic hyperplasia, is a condition associated with the enlargement of the prostate. The prostate enlarges in all men as they age and is very common after the age of 40. The prostate is located below the bladder and surrounds the urethra. As the bladder drains the urine, it goes through the prostate as it enters the prostatic urethra. As the prostate enlarges, pressure on the urethra is increased, resulting in the symptoms associated with BPH. The symptoms caused by BPH are the result of an increased pressure on the urethra. As the prostate enlarges, increased pressure on the urethra results in a bladder outlet obstruction. It is important to note that the size of the prostate does not always correlate with the symptoms. These symptoms can include obstructive and irritable symptoms. The obstructive symptoms include slowing of the urinary stream, stopping and starting of the urinary stream, straining to empty, and hesitancy of the flow. The irritable symptoms include nocturia, or waking up at night, increased frequency to urinate, increased urgency, and incontinence. The most important information in diagnosing BPH include a thorough history and physical exam. The physical exam includes a prostate exam to determine the size of the prostate as well as rule out any lesions in conjunction with the PSA. Additional tests that may be ordered include a urinalysis, a uroflow to determine the strength of the flow, a bladder ultrasound to detect the remaining urine after finishing urinating, a prostate ultrasound, and a cystoscopy, or camera of the bladder. Treatment and intervention for BPH is based on the findings and symptoms for the specific individual patient. These treatment options include observation without treatment, medical management, and surgical options. The medications that exist for BPH include alpha blockers and 5-alpha reductase inhibitors. Alpha blockers work by relaxing the prostate, and 5-alpha reductase inhibitors work by shrinking the prostate over time. Surgical options include open prostate surgery for very large prostates and endoscopic management. The majority of patients are managed with endoscopic management, which allows for a faster recovery without any incisions. BPH itself does not result in sexual dysfunction. However, intervention for BPH may have several sexual side effects. These treatment options should each be discussed with the urologist to determine the risks and benefits of each treatment. When BPH symptoms are not adequately managed with medical therapy, most patients are candidates for endoscopic intervention. A TURP, or transurethral resection of prostate, is a procedure where a camera is inserted into the urethra and the prostate obstruction is then resected. In our group, we use a newer technology called the green light laser TURP. In this procedure, a laser fiber is introduced into the urethra through the camera. The obstructing prostate tissue resulting in the bladder outlet obstruction is then vaporized. This allows for less bleeding, faster recovery, reduced hospital stay, and a faster return to normal activity.